just so you know, the chat has been enabled. Apologies for the glitch. So feel free to introduce yourselves. We'd love to hear where you're coming from and what organizations are here with us. So we're going to be starting our first Tadamon talks for 2023. So we're happy for you all to join us. I'm Svetla. I'm the communications lead with UNDP Europe and Central Asia, and I'm going to be moderating our session today. For those who just joined, we currently have Arabic translation, so feel free to select what you need from the control panel at the bottom of your screen, Zoom screen. That's the little globe icon, and choose Arabic. And if you're here with us really for the first time, our Tadamon Talks webinar series, really a wonderful space where we explore alternative finance for civil society empowerment, as well as civil society best practices. In the past, we've looked at a range of different things, from good crowdfunding topics, tactics, and digital transformation for nonprofits, to exploring what are the crowdfunding trends in Africa. So our series is powered by Tadamon, which is a wonderful cross-regional community platform for civil society empowerment. It's sponsored by our partners at the Islamic Solidarity Fund for Development and managed by the Islamic Development Bank, and implemented by the United Nations Development Program. So if you want to learn more about Tadamon, and of course what we do and the different programs that are available, feel free to check out our website. And if you're interested in knowing a little bit more about what's happened before with our Tadamon talks, feel free to have a look at them on YouTube. So for this month's Tadamon Talks, we'll be talking about how technology is transforming how healthcare is being delivered across the Middle East and Africa, and how that's helping more people in remote areas access better care. And we're going to hear from some of the amazing change makers who are behind this revolution. I'd just like to also drop a blog that we recently published that kind of details some of the exciting things that are happening in the region, some of the change makers that have been part of some of our programs. And you can read a little bit about the different ways that they're trying to change how healthcare is being provided. So as I mentioned, this webinar is going to be in English with translation. We're currently recording and streaming it live, so you'll get access to the recording afterwards. So without further ado, I'd like to give the word over to our partners. Ismail Mohammed, over to you.
Thanks, Safetla. My name is Ismail Mohammed. I'm the program coordinator for Tadamon. In fact, I'm pleased to welcome you all today at the Tadamon Talks number 11. And it's an honor and privilege for me to address such a distinguished gathering. Obviously, we all know that NGOs play a major role contributing to the welfare of the society, and their identity is reflected by the cause that they stand for. With that being the case, obviously, there are so many challenges that NGOs face in actually delivering and doing good deeds. These challenges include maintaining the credibility that help NGOs reach more and get a continuous or increased funds for their social projects. And obviously, then there is another challenge, sustainability. A few days or months or even a year, projects will never change or improve the welfare of the people that you NGOs want to help. Obviously, NGOs require persistent additional efforts to ensure that the challenge they envisage don't fall apart. I mean, the change that you envisage don't fall apart, and especially in the healthcare sector. Also, building the capacities of the people on board is a challenge for NGOs. Obviously, a community healthcare NGO require field workers that will not only give healthcare services, but also play an important role in spreading and disseminating the social message related to healthcare. So with that being the case, in this technological world that we live in, obviously technology has the solution for the challenges that you face. And I think you are on the right track. You guys are quite innovative. You have plans to invest in technology as an infrastructure, which is the right choice. So obviously in this changing world, also technology and investing in technology and adapting technological innovations are the keys for both success and change. And we are very glad from Islamic Development Bank and also Islamic Solidarity Fund for Development, along with our partner UNDP, to welcome you on board, to give you a forum, a platform through which we can all exchange the insight and also in-depth discussion to further actually invest in technology as an infrastructure to overcome challenges that we face within the healthcare. So without further ado, I'd like to conclude by actually handing over this to Savatla and wish you all the best. We will be part and parcel of this discussion as listeners and obviously respond where there is a need, wherever questions are asked. Over to you, Savatla.
Thank you so much, Ismail, for the wonderful words. And now we get to go into the core session, the core part of our session today. Our talk will be led by several change makers who are part of our first cohort of graduates from our Tadamon Accelerator. It's a program for civil society organizations and OIC member countries. And its goal is really to support and further develop and scale high impact solutions by using various business tools and approaches to do so. So we have a couple of, we have a couple of speakers with us today, which I'm going to introduce. Just want to put them center stage at the moment. Yes, here they are. So we have with us today Diana Yaffe, who is a nursing operations manager of Find a Nurse. Find a Nurse is a really great online platform that aims to make home care smarter, more affordable, and more accessible to families and caregivers. She is a nurse with more than 10 years of experience. We also have Majd Manadre, who is co-founder of Hakini. Hakini is an early stage startup that's based in Palestine that uses technology to increase access to mental health services, not only in Palestine, but around in the Arab world. Before starting Hakini, Majd worked as a financial advisor and tax consultant for 7 years at an international accounting and consulting firm. And finally, we have our third speaker. This is Nasser Diallo. He is the founder and CEO of Clinic Plus O, an Obama Foundation Fellow. So Clinic Plus O is a social enterprise that builds technology-enabled primary care solutions to limit various kinds of barriers that exist to accessing quality healthcare for marginalized communities. Before starting Clinic Plus O, Nasser worked as a public policy analyst at Facebook and has helped design various programs related to digital literacy to prevent internet shutdowns and stimulate the growth of the digital economy in sub-Saharan Africa. So we have a wonderful group with us. Thank you so much for accepting our invitation to speak. And now I'd like to invite each of you to share a presentation of the work that you're doing on the ground. We can start off with Diana.
Hello, everyone. It's really a pleasure to be here today and talk to you about our platform. So I'll share my screen. Okay, so here we go. I'd like to start today with a topic that is very close to my heart, our parents. They are the dearest and closest people in our lives. We feel guilty when we have to leave them. And of course, we want to make sure they're always in good hands when we're not around. But let's face it, finding a trusted caregiver is definitely a pain and a huge risk. Today, I will tell you how Find a Nurse has turned this pain into a peace of mind. Our journey began 5 years ago when our founder, driven by the desire to help his cousin make a better income as a nurse, started Find a Nurse. So looking back on the past 5 years, I'm filled with pride for the countless lives that we've touched through our work in many fabulous ways. Najwa is one of them. Najwa is a 55-year-old practical nurse, a widowed mom, and a supporter of a 4-member family. Najwa faced financial challenges, of course. However, with the help of our platform, she was able to generate over 160 million Lebanese lira in just 3 years. Stories like Najwa demonstrate the impact of our services, not only for our clients, but also for the caregivers who actually make it all possible. So how does it work? Via our online platform, families can easily meet and hire trusted caregivers in only a few simple steps. Our user-friendly platform allows families to easily select the care category and specific services they need, whether it's elderly care, newborn and child care, or PCR and lab services. Then after submitting the detailed care request, the platform will scan our pool of caregivers and suggest a personalized match or matches that best fit the client's needs. It's important to note that these aren't just any caregivers. Every caregiver on our platform has been interviewed, screened, and trained. So having a transparent system with diverse and detailed profiles and client reviews gives us an edge over the traditional agencies, not to forget being price competitive. So in comparison to freelancers and traditional agencies who actually also provide these services, we give families better value for the money. So as you can see here, Find a Nurse serves as a trusted intermediary between the client and the caregiver. We facilitate a smooth and organized work relationship, and we aim to eliminate all the inconveniences and challenges that caregivers often face. Why are we highlighting this? Why did I mention these inconveniences and challenges? Well, research shows that female caregivers are at a higher risk of experiencing abuse at the home care workplace. So we really focus on our work to empower these ladies by helping them achieve a work-life balance and feel protected while on the job. Since we started in 2018, our platform has served over 640 families, and we are able to create around 13 full-time jobs every month, mostly covered by vulnerable female caregivers. As we look here, it's clear that the market is huge and rapidly growing globally, regionally, and locally, thanks to the increasing elderly population and more women going to work. So definitely the need for home care services has never been greater. We recognize that this presents a significant opportunity to make a positive impact on the lives and the families and the caregivers alike. Although we are a work in progress, we are dedicated to create the ultimate solution for families, and we're excited to announce that we're currently developing an advanced digital platform that will use a smart matching algorithm to connect families with curated home care providers. We plan to test this technology in Lebanon and use it to reach new potential markets, such as the Gulf and North American markets. Our vision is to become a leading provider of home care services on a global scale, and this technology represents a crucial step toward realizing that goal. Our killer team has built a sustainable operations that has been growing organically with no paid marketing for over 2 years now. We are really committed to making the home care industry safer, smarter, and more accessible for families. Thank you for listening.
Thank you so much, Diana. And now over to Majd from Hakini.
Hello, thank you, Svetla. I'm sharing my screen. Hello, everyone. It's great to be here with you, and thanks for you, Tadamon, for hosting me and us, the change makers from your wonderful acceleration program. My name is Majd. I'm a co-founder and chief operation officer at Hakini. Hakini is an online platform that covers a full life cycle of improving your mental well-being. And during the last couple of years, and especially after the outbreak of COVID-19, the need for mental health services was tremendously increased. And it doesn't affect individuals only, but it affects all of us, including the economy, businesses, organizations, the education system, and the governments. Because of that, we created Hakini, which is an online platform that increases access to mental health support. As you can see, each year, depression and anxiety cost the global economy $1 trillion in lost productivity. This is because of different mental health challenges that people are facing on a daily basis, and lack of accessibility to mental health support, especially the prevention tools that can help us to overcome such challenges. For example, there are 1.5 billion people that suffer from mental health challenges around the globe every year, but 67.5% of these people do not get access to any kind of support. In the MENA region, the situation is even worse, where more than 80% of the people that need mental health support do not get it. And when we are speaking about Palestine, where I come from, more than 90% of the people that are looking for mental health services do not get such support. This happens because of several reasons. There's a lack of awareness about mental health. There is no accessible prevention tools that can help people on the spot and raise their awareness about the mental health challenges that they are facing. In addition, mental health services are expensive, and there is a huge shortage in mental health professionals in Palestine, in the MENA region, and around the world. So we came up with our unique solution in Palestine that aims to serve the whole Arab world. We solved this problem by providing mental health services at 3 different levels, starting from raising awareness by publishing and creating content about mental health, providing prevention tools and self-help support through our unique programs that are created by mental health professionals and are unique to the Arab culture that can help you to help yourself on your own. And for advanced support, we connect you with online counselor to help you in the process in case this is needed from your side. So let me show you how it works. At the beginning, you sign up to the platform, you answer a questionnaire to identify your need, and then you start the support through our mobile application. We grant you access to guided exercises and programs that are created based on the cognitive behavioral therapy approach. These exercises can cover up to 70% of the same process that you get at the mental health clinic or at online counseling session. In advanced cases, when you need to consult with someone, we can connect you with counselors that we match you with, and you can communicate with them through text messaging, audio, and video calls. This is our blog where we publish content and enable you to literate yourself about the mental health challenges that you face on a daily basis and also to be familiar with the cases that are more severe. However, we are not going to stop here, and we believe in technology. So we found there's a huge need for diagnosis assistant. This is a new feature that we are going to implement, and it will be based on artificial intelligence to help therapists and users to receive diagnosis in a better way. In addition, there are tremendous ways of improving our technology, such using virtual reality and gamification and other ways to make the service more accessible. So far, we were able to provide more than 100,000 online counseling sessions. We have 20,000 website users per month with an average growth rate of 35% during the last year. This is the feedback that we received from the people that used our services, and they are very happy with the accessibility that we are providing them through our online platform. This is how our growth was during the last year, and we hope to increase it more with the help of Tadamon and others that support our platform to make it better. Thank you so much, and we are looking forward to speaking with you soon.
Thank you so much for the overview. Really amazing traction and results. And finally, over to Nasser for the final short presentation before we dive into the conversation between all the panelists.
Hello, Svetla, and hello, everyone. So pleased to be here. I'm just going to share my screen. Just one moment. Hopefully it's going to work. Yeah. Are you able to see my screen?
Yes, everything's
okay.
Working.
Thank you. Thank you so much. So it's a pleasure to be here, and thanks to all the Tadamon team, and thanks to Ismail for being a great partner. So my name is Nasser Diallo. I'm the founder and CEO of Clinico. So what is Clinico? Clinico is a technology-enabled network of medical providers and partners that offer primary care services to low-income communities. What we mean by low-income communities here, it's people who make less than $2 a day in West Africa. Most of these people live in rural communities, which an array of 200 to 300 kilometers away from the capital city, Conakry. Those are the ones who receive primary care services. So before diving into the presentation, I just wanted to tell you that I just decided to show you a project that I am running. So this is a project that I am running. I'm on the ground right now. I'm doing the work right now. So it's a pilot project that I thought will give you a better insight of how we are doing the work that we are doing and how we are using technology to enable the work that we are doing. So to start, I just want to say technology is important to us, but it's just a tool that we use. What is extremely important to us is our stakeholders, meaning the community health workers that we work with and the patients that we work with. So to give you a context, what we do is to hire community health workers and then train them on how to use digital and medical tools, and then have them proactively walk to their communities to offer primary care services. So those are community health workers that you can see here on this photo that has been hired in an area called Urekaba, which is 360 kilometers away from Conakry, the capital city. So what is the aim of this pilot that I am running still in? It's to hire 10 medical providers, and those are the community health workers, conduct outreach with 20 local community leaders, and I will show you why it is important to do that, conduct health screenings for 1,000 community residents, and then test the clinical business model, because we have been around for less than 2 years. We are still figuring out a business model that makes sense. So this is the area in which we are operating. So you can see this line here. It's a railroad that is in constructions as the time that I am speaking here. Hence the reason for us to be here. So the water is polluted, the environment is dusty, and the conditions in which this railroad is being built is incredibly horrible. So we decided to jump in here and provide primary care services to to Urekaba. So Urekaba has 16 districts and 52 sub-districts. That's extremely important geographically, so we know where are the challenges and how we are offering. In this area, we are offering just primary care services in the district that are very, very close to the railway, which are Bantamaya, Urekaba, San Sebekoto, and Madina, as you can see on this map. So we have an approach that is a community approach, a medical approach, and a digital approach, and a field approach. So I'm gonna start with the community approach. So what we do, we come to the communities, okay? And then we tell the communities what we wanna do. We wanna offer primary care services using basic technology. And most of the time communities ask us how. And then we explain it through trainings. And then we provide them some certificates that enable them to understand how and why it is important to receive primary care services to technology. One, it helps eliminate the long distance travel that prevent them to access primary care services. It reduces the transportation cost. The long distance travel, it's more than 300 kilometers. The transportation cost is more than $22, which is beyond the reach because most of these people are making less than $2 a day. So we have trained 78 community leaders which are representing the 16 district and 52 sub-districts. Now, these community leaders have been sensitized and have been shown what is important in our work through the tools that we are using to offer primary care services. So instead of telling them what is telehealth, we show them what is telehealth. We take one of these leaders here, and then we dial the phone, and then we do the consultation. It's an aha moment. So it reduces the adversity of using technology. So we do it within the community. And then we come to our community health workers. These community health workers live in their communities in rural Guinea. So they have limited access to technology and limited knowledge to technology and limited knowledge to medical training. So we train them on how to use our technology, and then we train them how to use the medical resources. So once they are trained on how to use the medical resources or the medical equipment, we go on the field, we supervise their work to make sure that they understand how it works, and to make sure that they have the skills to do it on our behalf when we leave the community, meaning the training team. And after that, we go through the digital training portion, which enable us to show them our technology, to have them download it, to have them use it, and to have them, more importantly, test it within the community. This is how we enroll our patients. This is how we provide primary care services to our patients. And then finally, we go to the field, and we do not come with the assumption that we know what's going on in these communities. We come to ask these communities, what do you think are our problems? Meaning we meet our patients where they are, and we try to solve what they think are their problem, because healthcare is also a psychological problem. And then from there, we move it to the town halls to explain now what will be the process of doing our work. And most of these town halls have more than 300 people. What are the learnings that we have gathered from this pilot? It's community health workers are keen to work with us to build a digital healthcare system in Guinea. Residents are open to use Clinico digital health solution, and our subscription-based model can work. So we ask patients to pay the equivalent of $3 a year, and then they receive primary care services. And then we build trust with communities through outreach. And this is extremely important. Without it, we won't be able to work with the communities. So now we are doing the screenings in this area. I just want to thank you so much for listening to us. And I look forward to getting your questions. Thank you so much.
Thank you so much, Nasser. Really interesting to see and learn about your approach. As all the other participants, let's all put us on the screen. Second. Yes. So now we get to dive into the great part, and kind of go into the conversation about the challenges that you face, the opportunities, the way that you've been solving these challenges as they come up. So my first question to you is, of of course, there's a lot of different approaches to tackling healthcare challenges, healthcare problems in the industry, as there are so many. And there's a lot of traditional ways. So from setting up mobile clinics, from providing training to medical professionals, especially where there's a lot of huge shortages. As we know, the Middle East and Africa do have a lot of shortages in terms of healthcare workers. So, providing traditional education, engaging community leaders in traditional ways. What really motivated you to use technology to facilitate this healthcare access? What was your aha moment? What changed? What made you turn to technology as a solution? And what were the opportunities perhaps that you saw? These are just a couple of questions. Feel free to pick out which one you want to dive into.
Well, I'd like to say that, of course, the traditional ways they work, they're beneficial, and of course, they have a huge impact on the community. But technology, incorporating technology, is something that is definitely makes a big change in ways that we can't imagine. So technology, as was just said, that it can help you overcome barriers like distance and time. Like when people are living in remote areas or underserved areas, having this technology, it makes it more convenient for them in order to have their needs met. I can also think that when we think about technology, like we think about like automation and automated processes, and this definitely will increase efficiency of the operations and reduces like manual input errors, which realistically happen a lot. And with this, clients will have, or consumers will have better consistency, more accuracy, an improved customer experience. It will help us as businesses to save costs because we will need less manual labor. And not to forget that having technology will give us more chances in scaling and reaching new markets. And also what I think, like using technology and facilitating like healthcare access gives us a competitive advantage, definitely, because of course there are other competitors and other businesses or organizations that provide very similar services, but having this differentiates us from them and attracts more consumers to us, more clients who are looking for this user-friendly platform, smart, convenient, accessible. It helps them to meet their needs faster. Yeah.
Thank you.
Yeah, I totally agree with Diana. I think technology enabled us to become more innovative and creative. Is there a noise? Yeah,
go ahead.
So, for example, in Palestine, when we wanted to use technology in order to solve mental health challenges and issues, we dived in very deeply into the problem and started to understand what's going on, why such services are not accessible. So we found out that there is a huge shortage in the number of mental health professionals. For example, we have only 21 psychiatrists to serve around more than 2 million people. And in addition, if you look for the counselors and mental health professionals, it's just a few hundreds. And when you are talking about an area which is segmented and lives under occupation, so you need to come up with a very creative and innovative way in order to address the need and increase the accessibility to mental health support. So we use the technology in order to raise awareness, first of all, because it's a major part of the process in order to address mental health need. And in addition, to try in an efficient way to connect and make people to be able to communicate with counselors and mental health professionals. So as you saw on the presentation, so today we have more than 20,000 people that are educating themselves using the prevention tools, and people that actually connect with counselors. And if we compare this to the traditional methods, in 1 year or 2 years, we will reach the whole number of the people that are using the governmental institutions and the nonprofit services for mental health support, and even to be able to address the need of more and more people. So for example, last year there was 90,000 sessions provided by the governmental and nonprofit institutions in Palestine. But I think using the technology, this will make a bigger impact and enable more people to use and get mental health support.
Really
so this was
point.
our motivation to use technology for addressing the need for mental health.
And it's true, these type of initiatives sometimes are really rivaling government public services, and it's something that public services can learn from. Nasser, do you want to add anything to the conversation, or we can continue to the next question?
I just want to say really briefly that in addition to what my colleague said, to us, technology is an affordance. This is what we can afford to offer the services to the bottom of the pyramid. So if someone makes $2 a day and then your service costs $20, it's not going to happen. We have one physician per 10,000 people and 4 nurses per 10,000 people. So far, we have offered primary care services to more than 20,000 people in less than a year. Just do the math. And most of these people are receiving these services within the comfort of their homes, 360 or 50 kilometers away from where the physicians and the nurses are, through the support of community health workers. So I just wanted to say, to us, it's what we can afford, and that's why we call technology an affordance. Thanks.
Thank you so much. Thank you for sharing some of the context and the inspiration to why you decided to use tech to solve this, to work on these challenges. And speaking of challenges, being a social entrepreneur, we know that there's a lot of hurdles and obstacles along the way. First, being a social entrepreneur. Secondly, being based, for example, in regions like Africa or the Middle East. And thirdly, of course, for setting up something as big as a tech platform, digital platform that has very high inspirations and goals, such as to provide mental health care support to an entire population. My question to you is, what are some of the challenges that you've experienced as a social entrepreneur, or as someone who has been building specifically a digital platform? Feel free to share one or two challenges each that you've experienced in the past years, or you continue to experience.
So for us, we started before the outbreak of COVID-19. So the challenges that we faced, that people were not really accepting the use of technology to get mental health services. But thankfully, when we have a huge challenge such as the pandemic, it makes us to be more creative, and also for us as individuals to accept that there should be a way to address our needs in a better way. So we were able to convince people after the outbreak of COVID-19 that technology is the way to get such services. And using the referral encouragement and the referral method, it started to spread. So people started to share their experience and good experience and positive impact of using our platform, and it enabled us when we incentivize them to do referral method, it enabled us to overcome the challenge of convincing people to use technology to get mental health support.
Thanks, Maj.
Well, for us, having a tech platform in Lebanon, it's definitely challenging. The first thing, and what's like on the top of my head, is definitely the economic and the political instability that we are suffering from for the last couple of years. With the economic crisis, currency fluctuation, inflation, unfortunately, the absence of true government, protests happening every now and then. So this really makes it difficult for us to secure funding, to attract the investors and realistically plan for the future, because it's very unpredictable. There are other challenges like infrastructure issues, like electricity, internet, that we need to accommodate and find solutions for them. Many talents have left the country as well since the crisis started 2 years ago. So there's a huge brain drain, and it makes it difficult to find people with the right skills to join our team. And as I said, like there's no true government, so of course the regulatory environment is not structured at all, and it's not on the top of the list of the government for the time being. And finally, like what I can think of is that, like just like any other Arabic country or in the Middle East, there are cultural barriers that we need to take into consideration, whether it's gender roles, whether it's religious beliefs, privacy concerns. And like in Lebanon, we might face some lack of trust, influenced by all the corruption and the instability that we're going through. So yeah, basically this is the most challenging part that we are going through.
Okay.
Thank you so much. I think some of these challenges resonate with me. I'm just going to speak to those that might be a bit different. So once we created Clinical, we wanted to create a startup. That's what we wanted to create. So the first challenge we found, it's no one was willing to give us money to pilot this on the ground. No one, right? We tried a lot of accelerator programs, a lot of investors. So it was just impossible. That's why we turned into an NGO. And the problem with building an NGO, it's people give you money with some restrictions. We want to give you money because we want you to do X, Y, and Z. So no one is willing to give you money so you can try to build something sustainable. So it's just very counterintuitive when you want to build something something sustainable within your communities, okay, and you have no one who is willing to help you. And the development industry has poured money in Africa and many developing countries for years, and the solution is just what we know today, right? So why can't we try things differently? So on our end, before writing any line of code, we make sure that the system we want to build makes sense in real life, right? So in a sense, the technology that we are using is tested in real life before building that technology. In a sense, we did not sit down in a living room to build that technology. We have our developers that go to the ground. Right now, I am 400 kilometers almost away from Conakry, the capital city. That costs a lot of money. I'm here with a full team. And if you have no one willing to bet on you and you have no one willing to give you that money to build something sustainable, then you are just working with people who are in Paris, London, in New York, and who think that their solutions are the solutions of your people, whereas they are absolutely not, right? But since they have the money, they can dictate that. So finding very flexible investment, finding and trusting the people on the ground, those who are doing the work, to be partners, not just executors, people who you can give money and ask to execute, will be extremely helpful. Thank you.
Thank you so much. You really touched upon some very important challenges. I think me included, we'd be super interested in knowing a little bit more about how you're actually overcoming these very serious challenges, because some are part of the environment, and you need to think of creative solutions to those. So my question is, what is an instance where you've overcome such a challenge doing something creative? It can be something very simple. And in connection to that, what can programs like the Tadamon Accelerator, which we were part of, what can they do more to help you overcome these challenges, to find these solutions to these challenges that you're facing as entrepreneurs, that you're facing as building social initiatives and such platforms?
So on our end, I'm happy to kick this off. On our end, it's the way we are overcoming this challenge is very unpopular. What that means, it's building a hybrid organization. What is a hybrid organization? An organization that offers services to those who are in need without hurting them financially, but also building something sustainable. Our organization is divided into two parts. We are building a technology, and we are raising impact investment and money to build that technology. Because I think Diana and Majd can concur, building a technology, okay, can enable you to have something sustainable, because some people can pay for some of these services, right? But where are you going to get that money? And how are you going to build that? It's by raising money. It's by building something that can generate revenue that will decrease the need of begging money from the international community and international donors, because there is no such thing like money forever. And then the second thing, understanding that empathy and context matter in terms of offering services at a very, very, very low price, or at free or subsidized services for these communities, right? So we are encountering a lot of people who refuse to fund us because we are a hybrid organization. Oh, in America, either you build a nonprofit or a for-profit. No, we are not in America. We are in Africa. We are in Guinea, where you need to build a for-profit and a nonprofit to be sustainable. The market is 8 million people in Guinea, 100 million people in West Africa who have no access to primary care services. If each of these people can subscribe for your service for $1 a month, and they are willing to pay that $1 a month, you have a sustainable platform, because not all of these people can get sick at the same time. So you can build something sustainable and generate some revenue that will enable you, to take some part of that money and give it to the bottom of the pyramid, those who cannot pay for themselves, so they can get the help they need without always going and asking money from the others. That's extremely important. So I want to encourage every organization that is dealing with this kind of challenge to think about a hybrid model. And don't be discouraged. Not everyone will fund you, but those who will understand, if they decide to fund you, you will see a value. So this is what we are doing to mitigate the funding solution. And we are very grateful for the Tadamon, who understood that from the go and who is supporting this kind of endeavor in the region that we are operating. Thanks.
Thank you so much.
Yeah, I agree with Nasser. Can you hear me well?
Yes.
Yeah. You need to be very creative in the way that you are solving the solution in one hand, and in the way of being sustainable on the other hand. So thinking about the structuring and the model that you need to use in order to balance between both is very important, because at the beginning, of course, you need the people, the institutions, the accelerators, or the funders that need to believe in your idea and your solution in order to get you off the ground. Of course, you can contribute yourself, your time, maybe you have some money from your friends, family, but at the end of the day, you need extra money from people that believe in you in order to build what you are offering. But you don't need to count on it all the time. You need to think about sustainability as soon as possible, because the economy is changing very fast. Sometimes you would have a pandemic, sometimes the economy is failing. So if you are not sustainable on your own, you would not be able to survive. And this is something essential that we learned during the accelerator, that you don't need to go out of the context. You need really to design things that really work. And on the other hand, you need to think about the sustainability of your organization in order to increase your impact, to continue growing, and continue providing your existing services or solutions to your targeted audience. And yeah, I think this was a major thing that I learned myself during the Tadamon, thanks to the mentors and the valuable and great sessions that we had during the program.
Yeah, I agree with Maj. The biggest challenge is really to remain sustainable. And for us in Lebanon, and as I have said it over and over again, the economic crisis, we've been dealing with a mismatch for like the last couple 2 years between the client's purchasing power or ability and the caregiver increased caregiver requests or fees. Because like as finders, we do not set the prices of the service or the fees of the service. We actually allow the caregivers who are providing these services to set their own fees. So there was a huge mismatch. And in order to find solutions, we tried so many new pricing models. We needed to do a lot of adjustments. We started to offer like tiered pricing options, so with packages and different kind of bookings, so we can cater to different customer segments who have different needs and budgets. And like another solution that is still a work and that we're still working on is like setting a minimum and a maximum for the caregiver fees request. So with the minimum, we are making sure that they are receiving like what's actually adequate for them to have a basic income, and a maximum in order to keep this service as affordable as possible for the clients. We've added some additional services like transportation, meal preparation, basic house cleaning services. Of course, only if the caregivers are willing to do them. This can like provide the clients with additional value. So it's really important to always be creative, to always be flexible, and look for new strategies, and it's like a trial and error to see what works and what doesn't work.
Thank you so much. Really important points, and I think there's a lot of organizations that have joined that are working in kind of the medical healthcare industry, and I think a lot of the things that you're saying are resonating with them as well. Being all digital platforms, you're also data collectors, and as we discussed earlier, in some cases, the services that you're providing are rivaling public services, services that are offered by government institutions. Do you have, and you know, data collection, data is crucial for analyzing where we need to develop in terms of where do we need to place services, what kind of services, what kind of policies. This data is very crucial for that. And my question to you is, do you have any plans for using this data that you're collecting for evidence-based policy, or, for example, advocating for legislative change on a national level? Do you think about things like that in your work, or is it something that you're planning for in the future?
Thank you, Svetla, for this question. I think data is the most critical part of building a technology solution or any other solution, because it enables you to aggregate knowledge about the behavior, about how to become more efficient, about how to understand how your solution is working, and to provide as well evidence about the results and the impact that you are creating for your targeted audience and the people that use your platform. So for us, this is something that we considered from day one, but we didn't necessarily implemented it fully at the beginning. So it was a gradual implementation process. So the data collection that we started, it was at the beginning through interviews, and then manual data collection through surveys. And nowadays we are thinking about a smart implementation based on our learning from the past on how to implement such data collection process in order to become more efficient and also to become more convincing, either for the government, for educational institutions, for the hospitals, for the general public, on why they should use our solution, because this is how you give yourself credibility and enhance the processes and the services in your platform. Because if you don't have data, you cannot say, for example, what was your impact? What did you do during the past 3 years? How did you decrease or increase the accessibility to mental health services, for example, in our case? Or how people became happier, how it contributed, let's say, for example, to the education. Are students doing better after using the platform? Or if their parents are more aware about the mental health challenges, are they able to guide them in a better way to be better students, or to choose the path that they want in order to become successful in the future? So these are a few examples, but there are many processes to be implemented. I think everyone who's working on a technology platform or other kind of platforms, not necessarily technology, should consider this process, but not to be anxious about it, but to gradually implement it in order to sustain and be smarter and improve in a gradual way. Thank you.
Thanks, Marsh.
Yes, of course. Of course, it's a very powerful tool for creating positive social impact. With analyzing the data, you can identify patterns, you can have insights at the business level, or at our level. We can see where we are doing well, that we can see the areas of improvement, and we see where we need to do adjustments, and we can compare over time. It's super helpful. We're always at the service of the stakeholders, like the policymakers, the legislators. We are always willing to provide our data so they can make any informed decisions based on the evidence that we have.
Thanks, Diana.
Thanks so much. So on our end, we are also using data to support the work that we are doing in an evidence-based approach because we have limited resources. So we collect 3 types of data. We collect patient demographic data, patient vital data, and patient medical data. The patient demographic data enable us to get the consent of the patients and make sure that even though they live in rural Guinea, they own their data. And that's if they do not consent, we are not collecting that data, and therefore they won't be able to receive some of our services. So there is a huge data gap in Guinea. So the regulator is lagging behind. But I think our experience, or my experience coming from Facebook, taught me how to thoroughly think about data. So the patient demographic data is for the patient, and we do not share that with the Ministry of Health, and we made it clear with them we won't share that with the Ministry of Health. Now, the patient vitals data is a fascinating indicator that enables us to collaborate with the Ministry of Health to do some preventive approach of healthcare. So for instance, we do systematic testing for high blood pressure and diabetes, and that data is shared with the Ministry of Health to see where are the areas where the government can intervene in terms of outreach, or where other partners can intervene in terms of outreach, because as we know, high blood pressure and diabetes are irreversible, right? Once you have it, you have to take medication for life. Now, the patient medical data is another bundle of data that is highly secured, encrypted on our end, that we aggregate and share with the Ministry of Health based on some indicators that we have. But also that data is available to be transferred from one medical provider to another with the permission of the patient. So for instance, if you have an infection and you need the gynecologist, and our community health worker, with your permission, can ask you to transfer that data to the gynecologist, who is virtually available to offer you the primary care services. And again, that data is yours. So it's extremely important to use it. We are also in partnership with few universities, including the University of Harvard and the University of California, Berkeley, to make sure that we are integrating a design that makes sense into the output of the data that we want to collect. A lot of people collect data, or a lot of organizations collect data, but at the end of the day, is it that data useful for them? So the data we are collecting is a data that enable us to help the Ministry of Health, to help Clinico, and to help our patients, at least for now. If not, we are not collecting that data because it can be problematic. Thank you so much.
Thank you. Thank you all. I just want to remind the audience that if they'd like to ask a question, they can drop it in the Q&A or in the chat box. We're having a lovely discussion. I'm aware that we are a little over time, so perhaps if we can wait to see if there's going to be any questions from the audience. There is a question about ethical data use and how I mean, Nasser, you touched upon that a bit. You mentioned that you don't collect data at all if people don't consent to it. But if anyone wants to touch upon the ethics of data collection and how you make sure that you protect patients' privacy, feel free to chime in.
I can certainly start. So we do what we call co-regulation with the Ministry of Health, Department of Community Health. What is a co-regulation? So we bring in the Department of Community Health, we bring in the Department of Data Collection, and then we bring in the department, not the Department of Data Collection, sorry, the regulator, okay? And then we bring in an organization called the System Informatic Solution from the Ministry of Health. So we sit down together to think through what type of data need to be collected and what type of data need not to be collected and what are the implications. So this effort enables us to understand that this is an extremely difficult exercise, and there is no need to blame anyone into this, because it's a teamwork that needs to be done. So with that, we agree this is the type of data that we need to collect. This is the type of data that we do not need to collect. And this is why we cannot give you, government, this kind of data because of X, Y, and Z. So within those meetings, we have people who can go back to the Ministry of Health and advocate on our behalf and say, listen, I will not be comfortable if I, member of the Ministry of Health, give you this kind of data. So that the Ministry of Health understands why Clinico or other organizations will not be willing to give this kind of data for ethical purposes. But it's done with all the stakeholders in a room, and we call it co-regulation, to make sure that every stakeholder understands the process, why it is important, and why these decisions need to be taken together. That gives us a great ability to put context into the people who understand the data, and then go back to the leaders who necessarily don't understand data, but are eager to make decisions that implicate the use of data.
Thank you, Nasser. if anyone wants to join into the conversation. Otherwise, I'll ask, I think we have no other questions, so I might ask one last wrap-up question. Okay. So based on our conversation and what we're seeing in the Middle East and in Africa, there is a lot of potential in the digital transformation of healthcare. We're seeing there's a lot of opportunities. In the blog article that I shared earlier, we shared some of the experiences and initiatives that are sparking up in the region, and those are just some of them. I just wanted to, my question to you is, what do you see, what are the future trends in healthcare that you're seeing, especially from the perspective of tech and digital platforms?
I think since the COVID pandemic, the whole approach to healthcare has transformed, and we started where people are adopting a new approach of like virtual consultations, virtual monitoring of patients, and even now there's still this approach has proved to be super helpful. We can think that like with the electronic health records, they are now being increasingly adopted by institutions, and it helps like to better coordinate the care and have more accurate diagnosis, and patients, of course, will have better outcomes this way. AI, artificial intelligence, everybody's talking about it. It has become like an integral part in our lives, and I believe that its importance is increasing rapidly, and it's already being used, I guess, in healthcare for in some diagnosis and some like image analysis, but it's expected to play an increasingly more like important role in healthcare, and it will help like the patients get more personalized and efficient treatments.
Thanks, Diana.
Thank you.
Maj, do you want to say something? You've unmuted yourself.
Yeah, I think the technology is improving rapidly. As Diana said, the adoption of technology is increasing rapidly in the Middle East and North Africa, and I think it creates a lot of opportunities for people like us, change makers, people who want to create something new, to come and implement their ideas or their projects and find the audience that are willing to use it. We need to be aware about the very advanced technology and the traditional ones, and adopt the technology that is accessible to the context where we are living. So for example, if we want to implement artificial intelligence, first of all, we need to create a lot of work before implementing such advanced technology. We need the traditional clinics. We need the traditional technological solutions to be adopted by the audience. And then after they adopt it, you can gradually fit in other advanced technology. Because if you don't have the foundations and the processes that will enable you to use, for example, artificial intelligence, so there's no need at this stage to use it. But what is more important is to solve the problem and make the solution fits the needs of your target audience, and then, or from the beginning, think about the future, but you don't need to implement it right away. Yeah.
Thanks, Maj.
Thank you so much. I think I agree with what Majd and Diana has said. In addition to that, I will say it's important for us not to go with what is trendy. And what is trendy is usually what comes from Europe and what comes from the United States, right? So you may find an investor who might say, oh, why don't you use this? But you are talking about this within the comfort of your living room. You have no idea of whether this is gonna go. I think Diana has talked about electricity shortage, and sometimes internet is a bit expensive, right? So thinking about the context in which you're operating, and then understanding that it's not the level of technology, it's the efficacy of the solution. So what we are hearing here in West Africa and Sub-Saharan Africa is telehealth, artificial intelligence, robot learning. I think you have to understand who is your target audience. I mean, when we come to these communities and we show them a smartphone, they look at us like idiot and say, even when I go to the hospital, they are unable to help us. How can you help me with a smartphone, right? So what we are doing, our technology is worth nothing without a community health worker. If the community health worker comes to the community with the smartphone, then the patient is willing to have the community health worker dial the phone, the telehealth conversation, and then the community health worker as a medical authority facilitate the conversation between the patient and the medical provider. That's extremely important. If you think about telehealth from the Western perspective, I, as a patient, I have a smartphone and I speak with a physician. That's not the kind of technology we are developing here. It makes no sense in rural Guinea. So context, and making sure that technology is very expensive. What works in Vienna or in Geneva does not necessarily work in Conakry or Abidjan in Senegal, and accept that and create a diverse technology. The second thing, I am highly tempted to reach out to Diana and Majd, because some of the technology that they have might help solve some of the problems that we have here. So we don't need to reinvent the wheel, right? So I think some of the technology that I have might help solve some of their problems. They don't need to reinvent the wheel. So as intelligent people, we need to collaborate, exchange services. We have developers, they might have developers, to ensure that these resources are being used across the globe, because it doesn't matter whether we are in the Middle East or in North Africa or in Africa. What matters is the solution. So that's extremely important. And finally, can we think through the best way to fundraise together? Because a funder will take us more seriously if you are in Palestine, you are in Lebanon, I am in West Africa, and say, hey, we are solving almost similar problems. Can you help us with this kind of money so we can pilot that technology? I in my industry, you in your industry, and Diana in her industry. So I think that will give us a sample, a population sample that might make sense in 3 geographical locations that are extremely different, and solution that can be scaled across the globe. So I am extremely excited to be part of this Tadamon talk and to be part of this conversation, and I look forward to collaborating. Thanks so much.
Thank you so much for this really inspirational end. It was a pleasure to hear from all of you, and also the audience. Several people have already commented on kind of giving feedback to the conversation that's been going on. Really fruitful, kind of sharing the challenges that you've gone through, the challenges that you're currently facing, and some of the ways that you're working to overcome. And I think, Nasser, really this point in terms of collaboration and sharing of resources, this is a really great note to end on in this conversation. So we have gone over time, 20 minutes. So I would just like to thank you for giving your time and sharing some of your kind of insights and your journey. I'd also like to share for the audience, if anyone wants to learn more about Tadamon, to go to our website. And of course, you can sign up for a newsletter to hear about our future Tadamon talks. We have them every month. So thank you, Diana, Nasser, Majd, for joining us and telling us a little bit more about what you're doing in healthcare.
Thank you. It was a pleasure.
Thank you for the opportunity.
Thanks.
Thank you.
Yeah, thanks, Haidana.
Thank you.
Thank you so much.